This is a good example of a recurrent right-sided bleeding in a patient who has a small telangiectasia or even maybe a hemangioma on their septum. Wiping away the crust immediately exposes the active bleeding that has been troubling the patient over the last few days. A little cottonoid patty is placed beyond it. This is important because the patient's awake, and reducing the amount of blood that trickles down into the throat improves the tolerance of the procedure. Some local anesthetic is injected into an area already pre-treated with some topical anesthesia. This is very important as it really makes the procedure very tolerable and ensures that if the surgeon has to treat it multiple times with a bipolar ablation as been done here, then the patient really doesn't feel anything. A small probe that carries a high frequency electrical current through it is used. It seals up the area very, very quickly. It creates a relatively low heat thermal ablation compared to heated instruments and is much more accurate and definitive than using chemical cautery. Here we are now, we're going to retreat the area just in case there's a little bit of bleeding, and because the local's been placed, it's tolerated very, very well. But the thermal injury is still minimized as best as possible. This area is quite a fair way back inside the nose, and therefore we're not going to cover it with silicone, but just simply put some ointment on, and the patient's bleeding that's been troubling them for 2 weeks immediately ceases.